Well, hello there, Dr. Brian McKay, not just a chiropractor, Stanford, Darien, Norwalk, New Canaan. And again, I'm apologizing for the lousy name of this podcast, but hopefully you get some valuable information and make your life a little bit better. Well, definitely, and hopefully a little smarter. All right, I want to go over today's who told you you have to learn to live with headaches? Because whoever told you that is wrong. What happens today is everybody's quick to take a pill, and I'm not belittling a pill. If it works, take it. But does your headaches come back? So are you solving any problem? I mean, I don't think so, but think of the quality of life that you're missing out on with chronic reoccurring headaches. All right, chronic reoccurring headaches prevent you from sleeping properly, prevent you from doing your job fully, being a good spouse, parent, child, anything. I mean, headaches like walking around with a 50-pound backpack on your shoulders every single day. Because what happens is the tension that it creates has a far greater impact on the quality of life than just the pain. Now, it's quite easy to focus on pain because when you look at TV, that's all they talk about. And listen, that's what gets people to pick up their phone and to call me in the first place. But I want to bring a concept to you. It's like at the base of your brain is called the brain stem. And the brain stem comes down and it eases out of if you slide your hand in the back of your head and go down to where you feel the skull, we call it the occipital bone, and where it meets the top of your spine, you have brain tissue right there. And the lower part of the brain stem is right there. And what people forget about is, or don't even know about it. I mean, there's many theories as to what causes headaches. I'll present mine, and I'm presenting mine based on that. When I relieve tension in this area, there are many people with headaches get incredible responses, and it's just so open your eyes up, especially if you're not anywhere near us in Connecticut where we can help you with your headaches. So, okay, what happens is the brainstem nuclei, okay, they transmit pain signals. So if you're in pain, so you have to understand, it controls also because the brainstem and the nuclei are nerve bundles, okay? You have all these nerves that do different things in the body. We're talking about the nerves, the neurons in the brainstem itself. So if you've got a bone leaning onto the brainstem, you got to understand there's a strong potential that you're going to have a problem there, okay? And it could be mild at first. We just have a little neck discomfort. You know, you wake up in the morning with a stiff neck, but over time it could develop into a headache. So if you take tension out of the brainstem, okay, you're also going to affect the blood vessels that are controlled by the brainstem. So think of the brainstem as this relay system to the rest of your brain. And actually, to get a little technical, it is a relay system, and it goes, we call it the pons, medulla, and the midbrain. And this is where dopamine is produced. So if you're leaning on the tissue that helps produce dopamine, which is the feel good, well, is it possible to have a headache? Yeah, just alone in itself, and of itself, it's enough to have a headache. So, but the brainstem also controls muscle tone and tension. So when you have increased muscle tone in the neck and shoulders, it puts you out more of a risk to have headaches. Okay. Now, also too is the brainstem nuclei will modulate pain pathways. So if you modulate, if there's no blockage, listen, we live by I-95. If there's a blockage, there's spillover all over the side roads. I see it every day coming to work. I see it every day going home from work. There's a lot of traffic. So what you have is you're interrupting the normal transit of cars on a highway, and you have a blockage, and it goes other ways. So what happens here is you have effects that you may not be aware of, like a little tension in your neck could be coming from tension on these brainstem nuclei. It's very subtle. It could be very subtle at first, but your pain perception is more sensitive. Okay, the more sensitive you are to pain, the more headaches that you're likely to have. So, what also too is there's another thing I want to go over is when it comes to headaches. All right, pressure on the brainstem can disrupt the normal neurological function leading to headaches, but also creates, like, typically, let me explain something else. If you're having headaches, I mean, sometimes you have to get a CAT scan or an MRI of the brain, and that's for serious headaches, because most of the time your head hurts you can't pinpoint the thing is. If it's hurting inside your skull, you are in serious trouble and you need to get a CAT scan or MRI immediately. Only way to know that is if it's really, really bad. And, your doctor should request it. Now, if I don't see results after a certain period of time, I request it because I'm not going to take a patient on I can't help. But what happens is you have these misalignments, okay? And everybody, you go to your MD, they're going to poo-poo chiropractor. Oh, don't do this, do Botox. If it doesn't work, then don't come back. Seriously, I tell it to people, listen, if what I have to offer you is not working, this is not the right place for you. But sometimes you don't know. But also, too, is medical doctors aren't trained to look for this tension, the misalignments in the vertebra that can cause pressure on the brainstem. But I want to get to another point, too, is you have a covering over the spinal cord, the brain itself. And a lot of times you have tension in the neck and shoulder area. What happens is it creates tension on this covering. Think of this membrane. There's three parts: the pia, arachnoid, pia, and the dura mater. This is thick covering. It's like a enclosed system that starts up top of your head and goes all the way down to your lower back. And inside you contain the cerebrospinal fluid. And if there's tension on the neck vertebra, you're going to have a chance of having headaches. It does happen. You relieve the tension, you relieve the headaches. It just really comes down that simple. And it's kind of hard to differentiate because you got a bad headache, you're going to call it a migraine. It's like if you got a wrist pain, you're going to call it carpal tunnel. You got knee pain, they call it Baker's cyst. But let's take it a little down a notch. What happens is the chiropractic adjustment can target the misalignments that cause pressure on the brainstem. If you alleviate that pressure, if it's there, you can reduce the frequency and intensity of headaches quite nicely. Here's the other benefit: you'll sleep a whole lot better. So what happens there is, again, I touched on the dopamine production because dopamine is the feel-good chemical or neurotransmitter, to put it properly. And when you can enhance dopamine regulation with chiropractic care, you're going to combat headaches. It's really that simple. So you're not looking just for temporary muscle relief. You're seeking a long-term solution, and chiropractic care can possibly be that. There is the thing I have to say is there's many different types of chiropractors. Some work on different parts very well. Some think this one particular bone is going to solve all your problems. I think you need to do an exam. I think you need to give it a try. And if you're suffering with headaches, chronic, debilitating headaches, Botox is not going to solve it. I mean, insurance, they can get insurance to pay the $5,000 a month to get the Botox. I think they allow one a month, maybe so. I mean, it depends on your insurance company. But if you relieve the tension on the brainstem, I think you're going to see a much more positive result. Because I guess the one thing I didn't also touch upon is the fact that chronic tension, not only does it shrink your frontal lobe, but chronic tension dramatically increases stress in that your sympathetic nervous system is under siege. Try to think of it this way: it's a lot easier if you can grasp the concept of the yin and the yang. Well, I like to use that specifically because it makes it easy to understand. You have a parasympathetic nervous system and a sympathetic. Sympathetic is fight or flight. Parasympathetic is your day-to-day stuff, like you digesting your food, tear production, control your heart rate, control breathing, all the stuff you don't have to think about. Hopefully you don't have to think about. And that's kind of what you really want to understand, is that you really can have a much more deleterious effect on stress with subluxation. And we call it subluxation is basically when you have irritation of the brainstem or the cervical vertebra in the neck that can lead to these headaches. So I hope I didn't beat you up with too much, information today. But here's the one thing is, whoever told you have to learn to live with headaches is absolutely wrong. I'm Dr. Brian McKay. You have a question on your headaches, feel free to call. I don't care if you're not in my area. I do get people listening in different parts of the world at times. 203-656-3636. 203-656-3636. I'm Dr. Brian McKay. Thanks for listening. Have a great day. And if you don't live around here in the Stanford, Darien, Norwalk, New Canaan area, go see a chiropractor if you're having headaches. Give it a try. You have nothing to lose. And I hope you get relief from your headaches. Once again, Dr. Brian McKay, Core Health in Darien, thank you very much.